I'm Judy Stewart, and I'm one of the first 6 volunteers for Sheffield Community Contact Tracers, which started in April of last year. So I'm really only going to talk about the original study, which was in April, May of last year, when the 6 of us were trained to contact trace in a whole new way, that at a time when there was no contact tracing happening. As I say, I was one of the first 6. A friend who was part of the who started, the ones who started it with Jack, rang me because she thought I would be able to do this work. She knew me, you know, I was retired. I was in lockdown because I was over 72 and so on, and very frustrated and angry with what was not going on, reading about what was going on elsewhere in the world and what we weren't doing and so on. And it provided me with a chance to do something that really made sense, to do something for my local community, to you know, so being very frustrated about it. It made sense in so many different ways, from my own work as a previous work in prevention, working with the importance of working with communities, you know, working with voluntary sector and so on, made sense. And I there were people that were not at that time. There were no public health figures, as far as I know, on SAGE, and it just didn't make sense at all that they weren't being involved. I got a huge amount out of it, but it was also very stressful. I think what we did, we proved that volunteers can do this work and can do it really well. And because of all the ingredients that are there, I mean, because whilst we lacked legitimacy in terms of nationally, we weren't connected with, you know, big institutions, but we were connected with the local GP, and because we lived locally, we could, it was a basis for building trust, as a relationship of trust. And the GPs obviously were important in terms of who we referred to in that sense. And we knew what was going on locally, you know, so we could actually provide. What we found was we learned a lot personally that we could pass on to the community and family and so on. But we also, as volunteers in this group, we were helping to train each other. We had the 5 hours training, but then when we started, nothing was textbook, nothing, you know, followed the lines that was. So we learned a lot with every single case, and we were teaching each other as well as supporting each other. And that was really important. I think that's lacking nationally, this sense of support. We had what we call a support circle, where we would, you know, daily support circle, where we were coming together to discuss each other's cases, confidentially, obviously anonymously. So we were supporting each other and learning from each other. We had the support of mentors, each one of us, because at that time, people were being told to stay at home. And we were worried as non-medics, what if this person really needs help? How do I know? So we each had one of the steering group as a mentor who is a medic, and that gave us the confidence to know where to go. Because we were local, because we had this system of following each, I mean, we were cold calling, you know, the contacts in some cases, and that could be complicated, but because we had this system of supporting people on a daily basis if they wanted it, right through their isolation, right through their self-quarantine, if they were contacts. If we could be flexible depending on what their needs were, and they were different. Some people wanted just to be listened to. Some people had no idea what to do and needed, you know, we gave them advice based on the government advice, but we weren't instructing them to do, because we had no legitimacy to do that. So I think what we were doing we were helping them to think through their situation. We were helping them. Some people just wanted to be listened to, you know. Some people were glad that there was someone there who was going to ring them and talk to them, you know. Elderly Caribbean man in his 80s, you know, he said, I'm glad that you're there to talk to me, and so on. And other people, it was just like support with where you're going to get your shopping, you know, that sort of thing. Who's going to walk the dog now? And so I mean, one of my cases was where there was like a hot spot of infection in a healthcare setting, which and this was happening with social care as well. And I know that there was a lot of transmission in those areas, but because people were thinking, they were being very careful in certain circumstances in their professional situation, but they weren't, or even when they came home to their families, but they weren't, in one case, they weren't taking care in, you know, at coffee breaks. And that was where suddenly it was all happening. And in another case of a care worker who he worked during the week in a care home, and at weekends he worked with his father-in-law as a carer, and he actually caught COVID and brought it back to his father-in-law because somehow in the care setting he was using PPE, but because in the family setting he wasn't. And it was sort of, so I think we had the time to unravel some of what was going on. And even though in some cases issues were coming up, like, which meant we couldn't continue down those routes of contact tracing because, for example, management wouldn't allow it, or people were worried about letting colleagues down, or they couldn't afford to you know, all the things that have come up since. I think the fact that we were able to have these conversations, not just on a one-off basis, but come back to them, you know, I'll talk to you tomorrow, or shall I talk to you in a couple of hours time? It's too, you know, we've been talking too long now, you're tired, all that sort of thing, that flexibility. I think it helped people think their issues through. So even though they might, in the case of the two people, the person who was working, the healthcare worker who had shielding parents and had thought through, oh, what if? Actually, it needed a conversation with to really think, oh, right, I hadn't thought of that aspect. Oh gosh, now I really am in this situation. What do I do? To be centralized, to not be so centralized, to support the local, to support contact tracing going on locally, so we could work legitimately, as it were. You know, we could work with our local directors of public health, our local community setups. You know, we could put in place locally what we have, as well as build up these relationships of trust